Are you suffering with hip arthritis? Have you been less active because of the hip pain? Are you losing sleep at night because your hip is keeping you awake? Or worse yet, have you been losing sleep because the thought of having a hip replacement surgery is keeping you up at night and taking your focus during the day? If you answered yes to any of these concerns, then the Hip Arthritis Recovery Program is for you. This program is designed to treat hip arthritis at the root of the problem so that you can get long-lasting relief and get back to doing the things that you love for the rest of your life. And this program will work for you if you've been recently diagnosed with hip arthritis, or if it's been a year or two since you've been diagnosed with hip arthritis, or even if you've had hip arthritis problems for decades, it's still going to be beneficial for you. Most doctors are treating hip arthritis with medications and injections, but we all know that medications and injections only provide short-term relief from the pain and inflammation, and they don't solve the root problem. And surgeons are cutting out the arthritic joint surfaces and replacing them with artificial parts, but they're still not addressing the root problem of hip arthritis. And physical therapists will give you exercises to help with hip arthritis, but they tend to be focused on recovering from a surgery rather than avoiding a surgery, so they're not the best people to see in order to avoid having a hip joint replacement. All these healthcare professionals are truly doing the best they can with what they know, but that's the problem, is they just didn't go to the schooling to learn how to help people avoid hip joint replacement surgery so that they can heal hip arthritis naturally. Healthcare schools focus on teaching medical professionals how to use medications, injections, and surgery to heal, but they're missing the mark on this. They're not focused on treating the root problem of hip arthritis. And it's completely possible to heal naturally if you go through the right treatment approach. That's where the Hip Arthritis Recovery Program comes in. It is focused on helping people heal naturally from hip arthritis. My whole treatment approach is infused into all the components of the program. There's 3 components in the program. The first component is the curriculum. There's over 50 videos in there to walk you step by step on what to do to help your hip heal naturally. And whether you're having trouble just bearing weight, standing up right now, you're stiff in the mornings when you get out, or you can walk around and do things, but you know certain things are gonna flare you up, or you're doing fantastic, but you don't wanna fall back into those other situations, this program has you covered no matter where you are in your recovery journey on hip arthritis. The second component is live coaching. Now, weekly we have group coaching calls with myself and my team where you can ask us questions, get more in-depth explanations, and also see exercise demonstrations. Now, that's available to everyone, but if you choose, you can also get one-to-one coaching with my team so that you don't ever get stuck while going through the Hip Arthritis Recovery Program. And the third component is that you'll get access to our exclusive community of other people who are on the same hip arthritis recovery journey as you. In this community, you'll be able to see replays of our past group coaching calls. You'll also be able to talk to people within the group, and then you'll be able to post your questions and your progress updates. You'll see other people's questions and progress updates, and then my team is in there answering your questions and cheering you on. We know this program works because it's focused on treating the root problem of hip osteoarthritis. We've already helped over 1,000 people heal naturally from their hip arthritis by treating their root problem. Let me explain what this root problem is. The root cause of hip arthritis is a muscle imbalance. Let me use this bone model to explain it to you. Here's the ball and socket joint of the hip, and on the back you have the butt muscles, which we'll call the glutes, and then on the front you have the hip flexor muscles. These muscles on the front and back cause the ball to be aligned a certain way within the socket. And what usually happens is the glute muscles on the back become weak over time, which leaves the front muscles, the hip flexors, to become dominant and strong. And what that does at the ball and socket joint is it pulls the ball forward on the socket, causing there to be extra compression in there. And when that's held in that position over time, over months, years, and decades, and if that's how you walk and move around, then you're aggravating the surfaces inside the joint, and over time you develop hip arthritis. This is the root problem. And in case you're wondering how I know all this stuff, let me introduce myself to you. My name is Dr. David Medoff, and I'm a specialist manual physical therapist. And between my YouTube channel and my in-person clinic, we've helped millions of people heal naturally and avoid surgery. I've gone through extra training beyond my physical therapist training, and that's how I've learned how to find and treat muscle imbalances. And that's what's helped me to develop the treatment approach that I've put into the hip arthritis recovery program. Surgeons are not trained in finding and treating this muscle imbalance. They're trained in finding good surgical candidates who have bad hip arthritis that they know will do okay if they get a hip joint replacement. But you'll still have the muscle imbalance after going through a hip joint replacement. And this is the reason why people still have pain after having their joint replaced. And physicians looking to treat you with medications and injections are also not helping this muscle imbalance, because we know medications don't address your muscle strength, and injections don't either. They won't make those glutes any stronger or the hip flexors on the front of the hip any weaker. They're just dulling the pain temporarily. And physical therapists are great at helping people recover from surgery. That's what they tend to see most of the day. So if you go to them in hopes of avoiding a hip replacement surgery, as soon as their exercises stop working on you, they're probably gonna send you away from their office and go back to the doctor, go back to the surgeon to get what they have for you, which we know is not going to work at solving the root muscle imbalance. If you're tired of living in this cycle of seeing surgeons and doctors and physical therapists and not getting the relief that you're looking for, or you're looking at starting this process of seeing all these healthcare professionals and you're worried about it not working out for you, then I want to invite you to get a subscription to our hip arthritis recovery program so that you can begin to work on getting progress towards avoiding having a hip joint replacement and getting back to doing all the things you love to do. I hope to see you in the program. Bye-bye.